Hi, I am Dr. Hemant Palave. I am a Consulting Physician and Intensivist and a Director of Vedanta Criticare Hospital, Shirur. Today we will discuss in short about heart diseases and how to prevent them and what should be the emergent management that can be easily done that can be done at the small setup or the multi-speciality setup where we have the cath lab and all other instruments by side. Basically, heart disease, what is the need for discussing about heart diseases? Heart disease is the first major factor which is the non-communicable disease. What we call as heart disease is major component is heart attack in general language, or the myocardial infarction. What myocardial infarction is when the blood flow to the muscle of the heart is getting obstructed. There are three major arteries which supply, that we all know, to the heart muscle, and when the blood flow to the artery is getting obstructed because of any reason like the thrombus or embolus or the plaque which get ruptured, the blood flow to the heart muscle gets obstructed and patient gets heart attack. So what are the symptoms of heart attack? Heart attack or myocardial infarction, generally the most common symptom is chest pain. Chest pain, it is typically over the chest, radiates to arm, up to the chin, jaw. It can be up to the right shoulder, less probably, but anything above the umbilicus, the chest pain can resemble with the heart pain. And the second most common thing is whenever the patient has any immunosuppression condition like any diabetes condition, where there is probability patient cannot have the chest pain. Generally chest pain is associated with palpitations, anxiety, breathlessness, shortness of breath. Chest pain can be when person gets exercised, on exertion chest pain can increase, and it will be associated with other symptoms which we call as angina and unstable angina, where there are two types of angina basically, unstable and stable angina, where stable angina is patient will be having symptoms for the similar kind of symptoms for over a period of time, and unstable angina is worsening of symptoms along with the blood lab investigation showing abnormal blood test like TOP-T, CKMB and all. So what will be the investigations for the heart attack or myocardial infarction which we should consider? The basic and most important investigation will be ECG. So the ECG which are easily available and very economical. So ECG will diagnose heart attack, ST elevation or non-ST elevation even, or sudden changes in ST like ST depression or biphasic T or that kind of signs in ECG. We can diagnose heart condition or heart attack. The ECG must be followed by 2D echo. If there are absolute signs of myocardial infarction like ST elevation in anterior or any leads in coordinate leads, then we can go for the management directly, and otherwise there will be the other changes we should look for, like other investigation we should do, which will be 2D echo, where we get the motion abnormalities. There will be less mobile part of the heart, the part which is getting low blood flow, the part will be less mobile. So motion abnormalities will be there. There can be any valve regurgitation or associated conditions along with the heart attack. In severe cases, severe attack, there will be even ventricular rupture kind of complication can be there. Along with the 2D echo, we should be going for blood investigations. Whenever a patient comes to you, then what blood investigations you should suggest? The routine lab which contains CBC, electrolytes, RFTs, lipid profile, and in some cases if we need, we should go for LFTs to check liver enzymes which can indicate the hepatocyte hepatocyte involvement because of the heart failure. and along with those the basic foremost investigations will be troponin, tropi, we call it as tropi and tropti, which will be positive in recent attacks above more than 8 hours. Along with that, CKMB, which will be positive in 24 hours, which will remain positive up to 7 days, and other basic blood tests. In acute condition, basically these blood tests will not help us much, but the ECG, TROP-T, ECG and 2D echo will guide us what should be the course of the management. Basic thing is what we need to discuss today. These are the general management and general things about cardiac. I want to discuss about what should be the basic treatment in outside setup, where the small OPDs in general practitioner works with limited resources, where we should have at least one ECG and emergency drug kit, where you should be able to read or get help with the ECG. So what are the symptoms of cardiac disease? Cardiac disease, like we are talking about heart attack here. Heart attack is myocardial infarction. So basic symptom of cardiac disease or heart attack that should make you think that you are having heart attack. It is the chest pain. Chest pain is the most common symptom. Chest pain is going to be over the whole chest. It can be radiating to arm or back of the arm. It can radiate up to the chin or right side of the chest. Basically anything above the umbilicus can resemble a pain to the cardiac origin. Another thing is the pain, it will be associated with sweating, anxiety, palpitations. Along with that, there will be shortness of breath. So whenever you have condition where you are exercising and you are having shortness of breath, or along with that having chest pain, then you should go for the investigations. You should meet the doctor and get yourself evaluated for the cardiac issues. So what will be the investigations of cardiac disease, like what you should go, what you should look for. So basic investigation will be ECG. ECG will guide doctor what are the emergent, if there is any emergent condition happening with your heart, or any emergency condition that can happen with the near future, like with the help of stress test. The doctor can look forward. The basic ECG will be normal, but along with the exertion, like making you exercise, the changes in ECG will guide doctor that you are going to have cardiac problem in future. So these two are the basic investigation. Along with that, you should get your 2D echo done. 2D echo is the ultrasound of the heart. 2D echo, there what we look for 2D in 2D echo, is there any motion abnormality, is there any part of the heart which is not moving, or the movement of valves, or the ejection fraction. Overall the heart condition can be assessed with the help of 2D echo. So basically after 40 years of age, once yearly you should do 2D echo and ECG. Along with that, twice yearly you should go for stress test. Blood test you should be doing for checking yourself, like cholesterol levels, lipid profile. So lipid profile is going to help in deciding if your cholesterol is way too high, then it can be your heart condition which will be coming in your future can be avoided with the help of medications or dietary modifications or exercise. So that suggestion doctor is going to give you. So basically what if you are having chest pain which is of recent onset, which is over the center of the chest, radiating to left side, along with the sweating, along with the palpitation, anxiety and feeling of doom, what we call it as, then you should emergently go to the doctor, where doctor must be having should have ECG and other setup. If you are able to visit a hospital where there is active cath lab, then that will be best thing what you should do. So there is what will be the management of the heart condition like heart attack, what doctor is going to do with the ECG and basic investigation which you are going to have. So the basic treatment is going to be, if there is a cath lab setup, hospital is having cath lab setup, then along with the antiplatelet agents like aspirin, clopidogrel and atorvastatin, along with that doctor will go for angiography, angioplasty if needed, or if there is no cath lab setup, then thrombolytic agents can be used, which we know that if you visit early the treatment, better will be the outcome. So each minute is myocardium, basically the heart muscle we are saying here. So these are the basic things which you should look and which you should go towards. But what are the conditions, what are the things you should do to prevent cardiac disease? How should you prevent yourself from the cardiac disease? So basic and foremost condition is there are risk factor of cardiac disease. What are the risk factor? It is hypertension, the high BP. So high BP is a very important risk factor for cardiac condition. High BP causes the arteries to get rigid and the blood flow to the organs becomes difficult, which increases the cardiac workload and can cause future complications. Along with that, diabetes is very important risk factor. There should be lifestyle modification and medications from which you should control your blood sugar levels. You should monitor them regularly. You should visit your doctor regularly and make sure that your blood sugar levels and HbA1c remains in the normal range So basically the risk factor, two main risk factor is hypertension and diabetes. Along with that, the binge alcohol or excessive alcohol drinking is bad for heart. The nicotine intake in any form like tobacco or cigarettes is bad for heart. The salt which is high, if you are eating diet which is high in salt, then it is going to hamper your health and prone for hypertension and heart disease. So diet is very important prospect you should look for to improve your health, and the prevention of heart disease will be depending on your diet. So basically what diet must be fulfilled of. So diet must be comprising high fiber, like you should eat more fruits, green leafy vegetables, low carbs and low fatty meals, like no outside food. Outside is the pizza and burger. The high fatty food should be avoided. Diet should be enriched with the minerals like calcium, magnesium. Those will be helping with the proper blood flow to the vessels and blood flow from the vessels to the heart. This is the dietary part, and another most important thing is exercise. So lifestyle modification. What we call lifestyle modification. If you have bad habits like smoking or excessive drinking, then you should quit smoking or drinking, and along with that you should be exercising at least 45 minutes per day. Brisk exercise is walking or swimming or cycling or anything which cardio exercise we call it as. So the brisk exercise 45 minutes a day for a period for 5 days at least a week. This is very important for the betterment of your health and prevention of cardiac diseases. So conclusion of the talk is daily exercise is must. You should be exercising at least 45 minutes a day. Along with, you should have a nice healthy diet full of vegetables, fruits, high fiber, low carbohydrate and low fat diet. Along with that, if you have any cardiac condition, if you have any hypertension, diabetes like condition, you should visit your doctor regularly, get them checked and keep them under limits, within limits all the time. So be healthy and take care of yourself. Thank you.